Hello, everyone. This is Dr. Mary Lauder, and you are listening to the Since You Put It That Way podcast. It's the show that examines various health, wellness, and medical topics from unique perspectives. We will be having discussions and guests that will cause you to pause and consider, well, since you put it that way. Hi, Dr. Mary Lauder here, and welcome back to Since You Put It That Way, Cosmic Health and Wellness. This is Lyme Disease Part 2. I should call it Act 2 because you'll see in Act 1, Dr. Carol Ritberger took on the role of the spirochete. And so that was a great episode for her to go through and discuss how the spirochete and the bacteria work in our body and its evolution and the evolution of Lyme disease overall. So Part 2, we delve into a little bit more on treatment. And we delve into how you can find a great physician and how to avoid pitfalls in treatment that might be leading you down the wrong way. How to really find good care. So we have a little bit of discussion about that as well. So thanks for returning back to Part 2 of Lyme disease. Since you put it that way, Cosmic Health and Wellness with Dr. Mary Lauder and Dr. Carol Ritberger. Enjoy the episode. Let's talk about the co-infections. Let's talk about the viruses and then the other things like the Ehrlichii and the Bartonella that come along with Lyme. Is this just like a gang?
Correct.
Are we talking of
it's like Spanky and the gang
mafia here? Yeah. That's just not good.
Yeah, I'm showing my age. It's like Spanky and the gang. It's like Spanky just goes and everybody just follows it everywhere. It's like, yeah.
Right. So talk to me a little bit of why we see that in some folks, but maybe not other folks.
So for me, it has to do with the well-being of the immune system. It's just that simple.
Makes sense.
And if someone's immune system, for whatever reason, is weakened or compromised, and that can be an autoimmune disorder, whatever it may be, or disease. In that particular case, I think that those opportunistic little piggyback co-infections are going to become active. And there's something that's interesting with those is that because like the Bartonella and the Babesia, that what it does is that they actually mimic in many ways what Lyme is, what the spirochete is, and what it does. So if someone is, and correct me if I'm wrong, but it seems to me like it's almost easier to be able to test for co-infections than it is for Lyme. Is that accurate?
Yes, because the co-infections are more easy to be seen. Correct. Because the Bergdorf fairy tends to hide.
Yes.
And so then it's like they're in the hideout and they're calling the shots. And
well, they are.
And so they're in hiding out, not to be found. They're like the bacterial warlord, if it were,
Right.
I'm not sure why I've got all these gangster references here, but I've got them going.
Well, it's like they're saying like that now, Bartonella, you go out there and see, do we have an active immune system? What's going on here?
Right.
And I do believe, again, I know it sounds like Star Wars or something sci-fi, but it really is very interesting and true how they survive.
Yes. And when I eradicate them, because that is what you do, I actually follow the body's order of how it wants to eradicate them.
Absolutely.
And I found if I just decide I'm going to blast them all at once, oh, hell no.
Nope.
There's no way that's going to happen. And you just create just this horrible reaction in a patient.
Yep.
And I actually have seen the infections driven deeper in the tissues.
Yep.
And it's a disaster. And then we say, oh, I have an idea because there's heavy metals involved, because those we're testing, let's chelate. Well, no, because that upsets the calcium balance, and that upsets the detoxification capacity. That again, these bacteria go deeper in the
Yep.
system, and so you can't do that. And so what I have found, so if we talk about a complex patient, and let's move into treatment here, because this is where we're going here. If we have a
Mhm.
complex patient, they typically come in, it's a chronic condition, so it's multifactorial. End of story.
Right.
Yeah. And there's going to be trauma involved because it's a complex chronic.
Yes, there is.
End of story. And you're right, Lyme is what's happened to them. These infections are what's happened to them. There isn't anything any person has done that has caused them to get this.
Correct.
Absolutely not. And the trauma has the body's response to a traumatic event that's happened to them. So we've got the energetic patterning of that. We've got the biochemical patterning of that based upon the energetics. Stop me where I'm wrong, Carol.
No,
And,
you're
and then
absolutely right
we've
on.
got the infectious patterns that are then patterned because of the biochemistry and the energetics that are there.
Correct.
So then the body says, okay, now we want to get rid of them, but you can't just take one lane. I tap over here, I tap over here, I tap over here, I tap over here. And all these different areas are soft approaches to kind of see where I can get a breakthrough and then begin to get literally a drainage.
Right.
And then while we're doing that, I say, how can we support the cell's immune response for them to find their way back to what they energetically should know what to do?
Correct.
I think the very best way to do that, because we're now well into the latent, semi-latent, reactive, nefarious stages of, all this going on. Certainly past the acute, where just the antibiotics will do something. The best treatment I have seen, the most effective, is ozone therapy.
Yes.
Now, ozone therapy is O3. Oxygen's O2. So
Correct.
you get these little machines, you use medical grade oxygen into this. So O2 then electromagnetically, electrochemically cleaves. So O2 breaks into O, then that attaches to O2. So you get O3 plus O. The O3 is exposed to our system a variety of ways. If we infuse it into normal saline, that as soon as it hits the normal saline, that breaks up into O2 and O, and it causes a lipoperoxidase and lipolysis, and it causes the immune system to respond.
Mm-hmm.
You can also do that same thing by applying ozone to mucous membranes. And we use either rectal or vaginal insufflation with ozone gas. Do never, not ever put ozone in a vein as a gas.
Oh,
Public
God.
service announcement, standing up on a very, very big soapbox. Never. Always must be infused in solution. You can take ozone and you can drink the water. You can insufflate the nose with, ozone saline. A lot of things you can do. There are ways to do it. Find a physician who's certified in it. Okay, that's that. But when that occurs, there is a bioresonance with ozone that's noted in the literature, but people, it's like just states right there, there's a bioresonance that occurs. One statement in research articles, not much more is said. But that bioresonance, I believe, is what is training the body's immune system back to a more state of normal healing and health.
Right. Well, and the immune system has memory.
Yes.
That's something that we don't hear a lot about. I mean, it has memory to emotional traumas.
Yes.
Now, it doesn't go in and the immune system goes, well, that happened at 3 years old and this was exactly this thing. It remembers that biochemical change that happens in the body. And when that change gets triggered to any degree, even the most minute, that immune system remembers that. So when the ozone, what you're doing is you're basically clearing the slate per se, to where the immune system can go, oh, I remember that. and then it resets itself, and remembering that, and then it starts to function the way that it's designed to, based on a person's DNA, based on a person's genetic, their heredity of their family illnesses, the foods they eat, everything, and it goes back and it can do that. And I was thinking, as you were talking about with the ozone and how you go in and you look at all the different components and you address the different components, that's healing. That's not curing, that's healing. And healing is where we end up being better than we were before. And if we really go in and, as patients and the patient-doctor relationship is that there's an assumption or assumptiveness that maybe is on both sides. But when we go to a doctor, we assume they're going to heal. And think about the pressure that puts on us. Think about the pressure it puts on the doctor.
What? Yes.
And when the doctor can't do that or can't figure it out, and we think that the doctor just doesn't care, that is not the truth.
Not true.
I work with many doctors that will just literally lay awake at night and spend hours on the computer trying to do the different things. But so what we're talking about and what you're doing, Mary, is that you're saying, okay, let's heal this.
Yes.
Let's go in and let's look at it cosmically. Let's look at it holistically. And let's listen.
Yeah.
Part of the healing that comes with anything in the physical body that perpetuates anything that is abnormal in the body is the fact we're not heard. That's an ongoing issue. And so healing is listening, asking the questions and doing the things. Yes. The other thing that I've found when working with people in working with spirochetes and then also the co-infections, I go back, and I know it sounds very simple and we hear it all the time. Food is the best medicine. And so what can we do as patients? We can look at what we eat. We can look at, do we value sleep? What do we do to help our body, help our immune system, and create the environment where healing naturally happens because we're designed that way, versus having to go and do other things in order to heal? Mm-hmm. And I think that's where it goes back to the basics.
It does. It does. And, additionally with the ozone, I've used, because there's the co-infections. So I use the ozone immune system, and I use ultraviolet light.
Well, look at the frequency, look at the energetics of ultraviolet light and how the body responds to it.
Exactly. And so eradicating and giving the blood a treatment. There's herbal-based treatments.
Yes.
There is binders that I use, because when the toxins, including the bacteria and the different viruses and the co-infections, are released from the cells in different tissues, they have to be bound so they can be, they need an escort. We get to
absolutely. They need to be shown the way.
That's right. So we chauffeur them right out.
Exactly.
And so, and then at the same time, I think one of the keys is the mitochondrial support.
Absolutely.
Going back to that mitochondria, because that's driving protein synthesis. That's interacting with the DNA.
Yes.
That's interacting with the other organelles. That is taking and, producing energy through beta oxidation. And so you've got your fat pathways, as it were, and the, just the long-term, energy production and cellular repair and cellular respiration. And I think with the emotions, what I find is when I identify and hear those emotions and hear those traumas, I then attach it to the diagnosis.
Absolutely.
Because often part of the reason for the entrenchment of that emotional pattern or of the trauma within the body is because they weren't heard. We know the research shows very clearly if a trauma occurs And in the acute sense, the person is tended to,
Yes.
not that big of a deal. I mean,
Yep.
it's a deal, but it's not that big of a deal. It's
Yeah.
that there's continual trauma at the hands of the perpetrator, or the people who don't understand, or the environment they're in, you
Yeah.
know. And so that changes it. So we go back and we change those patterns. But by attaching that, you know, all trauma causes us to disconnect, dissociate. When we reconnect through self-compassion and connection, then what that does is that then clears the pathway energetically
Absolutely.
and
I
emotionally.
found as a medical intuitive, there's the consistent emotion of guilt
Mhm.
is something that just shows up all the time when it comes to Lyme. And again, because it happens to us, then we feel guilty that we do. Maybe we love going out in the woods and stuff. And then now we feel guilty that we went out in the woods. And now we're somehow being paid for that or whatever. Or we feel guilty because we can't heal it. Or we feel guilty because we can't figure out what it is or whatever it is. And for me, in the energetics of guilt, is they basically take, and it's like taking a cell and wrapping it in a I'm going to use like a tape, just wrapping it in something and compressing it and compressing it and compressing it. And so now the cell has the vitality inside, but the emotion of the guilt is so strong that it's like it can't break that tape apart. And so when we get to the place where we look at it from the psychological part and we look at guilt, I mean, my goodness gracious, this is human emotion that we experience sometimes even with minutes after we're born. You know, maybe we cry. Well, we're supposed to cry, but don't cry. It's just unbelievable, the ramifications of that. So I think when we're looking at the over part, especially the mitochondria, I think that it's not therapy. We don't need therapy, but it's like guilt be gone. What can we do to help the person?
So then guilt, okay, close cousin is shame. So guilt is,
Absolutely.
I did something wrong, I'm a good person.
Yep.
Shame is, I'm a bad person. And
And
I,
the two are so closely aligned, and they're aligned chemically in the body, the way the body responds. They're chemically related, the way cortisol is released.
yes,
And when we go in and it goes from like, I feel bad to I am bad, now in the world of Lyme and co-infections and even viruses, now it's a perfect place. Now it's a perfect setup in the human body for
yes,
things to do what they do. So that's one of the things I've found.
yes. And so, yes, so I treat both the guilt and the shame, but I find that shame being a little more, recalcitrant's not the right word, but a leading. And then, and guilt, when I explain it, they tend to go, oh yeah, I can let that go. But it's the shame that tends to have a little bit
Oh,
of thumbprint on that.
well, and we carry the shame in vital parts of our well-being and the organs and the glands in our body. We carry that shame kind of to the deepest core of who we are.
Yeah.
And it's a shame for me, I've found as a medical intuitive, the way I explain it, it's like the way an oyster makes a pearl, is that we can feel guilty and then we go from feeling bad to being bad. And that's like that little irritant in that oyster shell. And then over the course of time, it gets built on and built on and built on and built on to the point where it almost becomes so beautiful, like a pearl, that we forget there's a core to it, that it started out as an irritant. And then when we start to look at shame that way, then we can start to understand the layers to it. And then which layer? Do we start on the outside? Does it make any difference? Do we start on the inside?
I don't
It
think it's,
doesn't make any difference.
oh, I don't think so. No, because I clear it out by using phrases such all the times and ways.
Absolutely.
And it depends on if I'm dealing with this lifetime, with the DNA, with generational,
Yep,
I just put the whole phrase together, and then I make the thread, as I call it, and put it through the immune system, present it to the nervous system, because the nervous system goes, oh, I
absolutely.
remember. Ah, thank you. I can actually process that. You said it, you gave it. So it's like starting a zipper. You know, after you start the zipper,
Exactly.
you don't stare at it. You continue chewing your gum and walking and going outdoors, right?
Right.
You don't pay attention. But to get it started, you have the right get-go.
Yes,
And so the same thing with this, when you present this to the immune system from an emotional standpoint, it says, oh, thank you. I got this.
absolutely. And then and even the mind, whose job is to keep us surviving, and who uses these emotions to keep us surviving. It's like when we say, oh, okay, well, I recognize that. Then the mind goes, oh, okay, well, they recognize that. I can go do something else. And what
Yes.
does that do? That lets the body, the chemistry, the dynamics, the natural balance of harmony and energetics, everything remembers like, oh, this is what I'm supposed to be doing.
Yeah.
This is the way I'm supposed to be healing. You said something that I think when you were asking about the purpose of the spiral key, you use the word generational, and we use that a lot with us. And if we went in and we became the spiral key, it's generational. Everything is generational. That's evolution. And if we can look at the spiral key as an always evolving bacteria, and what we can do is we can eradicate it, and I do believe in this case we can, is we just have to change the generational pattern the same way we do as humans.
Yeah. Yeah. Well, and I think that's what we're trying to do in our healing approach now.
Absolutely.
It's looking at
Healing being key word. Absolutely.
and I agree fully that it's not just putting someone into remission. I've literally seen my patients healed of this.
Be
And it's
better than they were before.
yes. Yes.
And when you're not heard, that seems impossible.
Yes.
And then that shame comes up, and that little core. And so, yeah.
So then, moving in, as we kind of just touched on some of the treatment principles,
Mhm.
I think what I want to step into for just a minute too, as we wrap up this topic on Lyme, is going to be, how do you find someone who knows what they're doing? Great question. So I'm going to have a couple quotes here.
Good.
First of all, as a physician, I have a public service announcement. You want to find someone who knows what they're doing, right?
Yep.
And I call it a public service announcement. And also, if it walks like, talks like, sounds like, looks like, it probably is. I'm going to finish the sentence. A quack. Watch out. Now, if we use the word quack and look at it from a noun standpoint, the actual definition is the following: a fraudulent or ignorant pretender to medical skill, a person who pretends professionally or publicly to have a skill, knowledge, or qualifications that he or she does not possess. I have to say something about this because of the social media influencers, everything you can find out in our online world, that people don't know what they're doing. Now, generously, I say this, that physicians are trying their best. Generously, I say this, some physicians miss the mark. And generously, I say this, that some physicians are not listening and some physicians are just exhausted. Yes, I get all of that. I know our system's broken. I know we need changes. I understand that. That's why I'm doing what I'm doing, even today. Okay, I get that. So, and I know Carol and I, when we talk to one another, we're essentially in the choir and we're preaching to one another about this. So we get it. And some of our listeners do, but there are some that might be new. But I want to make sure to really lay out, I also have firm boundaries on who gets to do what for patients.
Oh, absolutely.
And if you're one of these, I'm going to try and say this very, very carefully, functional medicine providers, please find out what certification that individual actually holds. the word provider in the Webster's dictionary, and yes, I'm using quotes from Webster's and the unabridged dictionary, is a person who has a high professional standard within a profession, typically medicine. So, or an attorney or an accountant, they are a professional. They have a license. So I really say be very careful who's doing what, because people have come to me after spending thousands of dollars of not getting well. And then when we diagnose them and actually begin to treat them, they go, I can't do this because I don't have any resources left. And it's really hard to pick those pieces up. It's very difficult.
Yes, it is.
And then also the trust. Why should I trust you when you know, people have said to me, well, you just did one test and found it. Why should I trust you? I'm like, well, because it was the right test, number one.
Right.
And I knew where to look, number two. And number three, I've been a physician for 30 years. So let's put all that together, right? Let's just be honest here.
Well, I think, and I'm going to jump in, excuse me for interrupting you, but I think you hit on something that is really, you ask a question about the conspiracy part of it. I think that social media has value, but I think exactly what you're talking about is so important. If you don't feel heard, if you don't feel like you can trust the person, if you aren't being able to ask and dialogue and do the different things, they're not the right person. They're not the right person.
Instant cure. And it's thousands of dollars right off the bat.
Yeah.
Watch out.
Absolutely. Absolutely. You know, that old saying, if it looks too good to be true, it probably isn't. I mean, I hate to be cliches as well, but I think that, you know, all this that we're talking about with the healing part of it is that it is important to really trust the person. I say that if you don't trust the doctor, the pill won't work.
Right. That's true. Yeah. Placebo, 40% of the time, hyper placebo,
Absolutely.
65% of the time it'll work. Even if I'm giving you a sugar pill. Absolutely. The therapeutic relationship infuses up to 65 to 70% healing. I get that.
Right.
And there are clearly what we're saying today is there are objective tests to finding out whether or not you have Lyme.
Absolutely.
And there are ways through this that don't include or only isolate antibiotics if you're well into the advanced stage of Lyme. And the perpetuated state. Where the antibiotics won't get to it because those won't penetrate the biofilm. They won't.
No.
They won't penetrate the tissues. They won't. Because if they just won't. So we have to treat the body differently. We have to find out a different way to do this. And so I think that that's really important. So things to look at about a physician or provider, depends. What are they promising? Number two, what are you looking at when you're making my diagnosis? How are you coming up with that? Number three, what's available for you to look at? Do you have access to the most advanced tests, the tests that even the CDC are adopting, which are now some of these other labs that are bringing in the better testing past the Western blot, and who's available for you to refer to, i.e. what's your scope of practice, right? What are you selling? And what you're selling, is that based on any scientific exploration? What are your credentials? What's your training? What's your success rate? And what are you willing to put on paper? I'm not saying you can guarantee a healing, but I'm saying what type of informed consent? What type of disclosure? Do you have a reputation you can stand behind and stand up with? And I think those are the things to look for. And the antibiotics are not the be all end all. The other therapies and other ways to do this. And the key is the accuracy in the diagnosis, which then leads to the accuracy in treatment options. And looking at this from a holistic perspective, and it's going to take time. I mean, healing is not a 3-week event.
Not. It
could take 3 years. It could take 18 months. It could take 24 months. It could take 36 months.
Well, healing is participating with your doctor, participating with your practitioner. It's curing is going and fix me, just fix me. But healing is that you're involved, you're committed, you will do what you know you can. One of the things as a medical intuitive and the way I look at illness is there's multiple layers to it. And if someone can see one layer that they can relate to, that they can say beyond a shadow of a doubt, I can do that, then there's healing. That starts the process.
Yes.
And sometimes it isn't just the physical body. Sometimes it's something else. It doesn't, and like you say, one size doesn't fit all with it. But I think that it is very, very important. And I think that, a lot of people with insurance, I think it's important, if you're going to work with someone, find out what their insurance policies are before you go in. Or a lot of times with the healers that are out there, and I'm probably going to get in a lot of trouble as well, is that what they offer, is it covered by insurance? So I always say, well, step back and look at what can you afford? And we're desperate. When we hurt, we're desperate. But go in and say, this is what I can afford. What can we do? What is the protocol? I mean, open up the dialogue.
Right.
So, but
That's
yes.
right. Yeah. And so I think that's the key. You need a physician or provider who's smart, has good clinical skills, observational skills, trusts their own judgment, intuition, and listens to the patient.
Always listen to the patient.
Yes. So, well, all right. I think after this, world peace. I mean, we got Lyme in the can, right?
Right. we know the life of the spirochete at this point in time.
We do. Yes. Yes. And so our cast today, Dr. Carol, waiting for the role of the spirochete, and Dr. Louder, weaving the web and the tail of the Lyme. And the historical perspective. Well, thank you, Carol, again for another exciting double episode here on Lyme, part 1 and 2. And so that's been great talking with you. I think we've got some more fun topics coming up. So I'm so glad that you're a part of this, and I'll look forward to our next conversation.
Well, thank you. Always a pleasure to step outside of the lines with you, Mary.
Yes, we did that. Yes, I used a lot of crayons today, and all were outside of the lines. Awesome.
Oh, you risk taker, you. We also be that way. Anyway, always a pleasure. I really enjoy your knowledge and your clinical perspective and your intuitive perspective.
Yes, and the same.
Thank you.
All right.
Thank you for joining us on the Since You Put It That Way podcast. Today's episode was written and produced by Crowded Table Productions. Technical editing, Malin Long Lopes. Sound editing, Jonathan Fiegel. Music, The River Jordan, written and performed by May Erlewine. Please rate and review our podcast as well. We appreciate your feedback, and hey, be positive, share the love.